Continuing our coverage of the coronavirus. Now, Ohio only has 5 confirmed cases, but Dr. Amy Acton says the actual numbers could be in the tens, if not hundreds of thousands. Now, there are so many questions about how this virus spreads and why it's different from anything else we've seen before. So we are calling in the experts to help answer those questions.
Dr. Bill Miller with the Ohio State University's College of Public Health is joining us now. Thanks so much for being here. We appreciate it because there are so many questions out there. Sure. A lot of people may not know, but you're also an epidemiologist. So first explain in layman terms really what that does.
Sure. So an epidemiologist historically meant someone that studied epidemics. And now largely it's the study of diseases in populations rather than in individual people.
All right, so something you're awfully familiar with. And when it comes to the virus itself, it seems that people are confused over the definition of what is a coronavirus.
So coronaviruses are a family of viruses. There are several that infect humans. Many of them just cause a common cold. Okay. But SARS was a coronavirus. That was in the early 2000s. This coronavirus is actually quite related to SARS in many ways and has some of the same features.
Mm-hmm. But this is a new one, right?
But
the new strain and everything like that, and that's what you guys are studying.
And so this virus actually arose from bats, and there's a much larger family of coronaviruses in bats currently. And what's happened is as the human population has pushed the bat population to be more closely living together. As a result, these coronaviruses have adapted to shift across bats, and that has led to their ability to move into other animals and into humans.
So, hence why we're seeing 130,000 cases worldwide.
Right, and as far as that number goes, I mean, we're going to see that go up dramatically. Right?
Yes, absolutely. Well, in the United States, the one thing that's absolutely critical for you to understand is that we are under testing. So we have not been testing as much, and if you don't test, we don't have cases. So we are probably, at least several tens of thousands to maybe even 100,000 cases behind in terms of what's been reported.
And what could really be out there to come.
Correct.
So, obviously the reaction to this coronavirus has been very strong. Here in Ohio, we were the first state to close down K through 12 schools, and other states have now followed suit. Why such a strong reaction now as compared to when SARS came out, H1N1, the swine flu, all that stuff?
Well, I think the best example to use is one from the 1919 flu epidemic.
Okay.
I'll give you a scenario of 2 cities. In Philadelphia, they were very slow to respond. They continued to hold a parade that was scheduled, and they had just a dramatic increase in the number of cases and the number of deaths because they just went about business normally. St. Louis, on the other hand, was very proactive. They essentially did what we're trying to do right now, which is social isolation and shutting things down. And as a result, they had a much, much slower increase in the cases and many, many fewer deaths. So in epidemiology speak, we talk about flattening the curve.
Okay.
So our goal is, instead of having the epidemic look like this, we want it to look like this, because that allows us to respond, that allows us to keep people apart and to make a difference.
A look, visually at exactly what Dr. Miller's talking about here. So hopefully through the quarantining, the social distancing, we'll see that as more and more cases come available. Dr. Miller, we appreciate you taking the time to talk with us about this morning.
My pleasure.
And we're not going to shake, we're going to air bump, right?
Yeah, we'll do a little.
There we go.
Thank you very much.